Hi everyone, how are you doing? Welcome to the Physio Brain channel. This is Professor Edrano, and today I'm going to share some exercise tips to help relieve that tension headache, which is mainly caused by muscle tension. Here in the neck, the muscles here in the shoulder, which cause headaches, okay? So stay with me and don't miss these tips. And as you already know, subscribe to the channel. If you haven't subscribed yet, like the video and share it with anyone you think needs this information. Oh, and over there on Instagram too. Don't forget to click here in the description and follow us on Instagram, where we have a lot of great content. So everyone, we know that headaches or cephalalgia are multifactorial. There are numerous and diverse factors that can contribute to the initiation and development of headaches. Among this wide array of potential causes, one particularly common type is the tension headache, which is specifically brought about by the sustained contraction and tightness of muscles. It decreases cerebral blood flow, which increases pain in this area, not just in the cervical and muscular regions, but also as a headache. This can happen, and this process is very well described as headaches resulting from muscle tension. And with this video, I want to share some tips and guidance because a lot of people have been asking for advice on how to relieve these pains. So I'm not going to say that this will cure your headache. And I'm not saying that this will cure your headache or that this is some kind of miracle promise, because it's not. This needs to be done alongside other treatments, okay? So you need to be following up with your doctor, and you need to be taking medication if necessary. So this is just a compliment, right? And don't forget to see your physical therapist or your trusted doctor to get the most appropriate treatment possible. But let's get to it. Here are some tips that can help you in this process. So the general idea is to reduce the tension in these muscles. And we're going to do this through movement, through exercises, through stretching. The first one is you're simply going to turn your neck to the side and hold it in that position. You don't need to force it too much, just enough so you feel a slight stretch on this side, so it feels a bit more tense here. So you're going to hold it like this. Count to 10 and then return. And then you're going to do the same thing on the other side as well. So you'll look to the side and hold that position for about 10 to 15 seconds, right? Start with 10, then go to 15. If you can get to 30 seconds, even better. If it's too easy, if you're not feeling anything, when you turn, push a little bit more. And then you'll feel the stretch happening. Be careful so that when you turn here, don't turn your other shoulder, otherwise you won't be stretching anything, okay? You're just going to turn your neck to the side, all right? All right? Same thing on the other side. If you're not feeling it, push a little more, then you'll feel the stretch a bit more. With this strategy, okay? The second one is very similar, but instead of turning your face, we're going to tilt it. Tilt your neck and hold it. This one, I already felt it much more than the other. Count to 10, count to 15. If you can get to 30, even better, all right? So do it to one side and then do it to the other side as well. And just like the other one, if you're not feeling it, you can help by pulling a little more here, okay? This will increase the tension right there, you know? The stretch will push a little more. And then you can notice how you're feeling. If this is too easy, you can push a little more, pull a little more, giving that extra help with your hand, all right? So 2 tips so far that are really simple to do. The next one is very similar, but the direction of the movement is different. You're going to try to bring your chin to your chest. So you bring your chin to your chest, hold that position, and count to 10, right? After that, you can increase to 15, 20, until you can reach 30. Chin to your chest here, okay? And the next one is the opposite of that. So you're going to try to raise your head, look up at the ceiling. So you hold that position for 10 seconds, and then gradually increase until you reach 30 seconds as well. All good so far? For now, these are really simple movements, right? And the idea is, by the end, you'll notice that these are very simple and easy movements and strategies to do, but they can really help reduce that tension headache. Now we're going to do a bit of isometric exercise and isometric strengthening for these muscles, which is also very good because strengthening can lead to stretching and also relaxation. It's not just stretching that helps us relax. Sometimes with isometric or strength exercises, we also promote relaxation and reduce pain. So what are we going to do? You're going to place your hand here and try to do that tilt we did earlier, remember? try to make that movement, but your hand holds it in place. So you tilt over there, and your hand holds, count to 10, and release. Do it to the other side as well. Try to tilt, and your hand holds it. There, count to 10 and release. Okay? So this can be done for 10 seconds, 2 to 3 times for 10 seconds, until you gradually increase to 5 times for 10 seconds. And you'll notice that it gets easier each time, and you'll feel less and less pain. Now, another very good exercise to relieve this tension, and consequently tension headaches, is to simply let your arms relax and just lift your shoulders. Just lift your shoulders up and lower them. Lift and lower. Notice that I'm not lifting my arms, just my shoulders. It's just a shoulder movement. I like to tell my patients to try to touch their shoulders to their ears, right up to the ear. But you're not supposed to bring your ear to your shoulder, so just lift up like that 10 times. You can start with fewer, 5 or 6 times if it's very painful or hard to move, until you can do it 10 times. If you can do 3 sets of 10, that's great. You can also repeat it several times throughout the day. The next one to do is also with the shoulders, with your arms really loose and relaxed. You're going to make circles with your shoulders going backwards. So you're going to try to lift, move them back and return. Make circles with your shoulders going backwards. You can do it 10 times, right? You can also start with fewer, and then you're going to make circles forward. So circles forward as well, okay? So circles forward. I don't know why, but for me, it's easier to do them backwards. I'm noticing this difficulty now. All right? So circles forward, circles backward. 10 times, and pay attention to whether it hurts or if the tension is decreasing. Of course, it might not bring immediate relief, but the tendency is that as you repeat and do it more often, it will help to release that pain, okay? And finally, the exercise we're going to use to finish is also a very simple one, which is to make the movement of tucking your chin in, okay? So you're going to try to move your head backward. Without doing this here, so what you're going to do is bring it in, right? As if you were tucking your chin in. So tuck your chin in and return. Let me do it from the side so you can see how it's done. Look, so you try to bring your chin back, chin tucked in. You're going to work on this cervical movement. It's very simple, very easy to do. You can also start with 5 or 6 repetitions, and then you can do it 2 or 3 times as it gets easier. You'll notice I'm very confident that this will really help to relieve your pain, okay? So that's it. Some good exercises you can do to help relieve the tension in these muscles, in this cervical region, which often causes headaches. So if you have a headache and you believe it's tension related, do these exercises, repeat them over and over again. The tendency is for the tension in these muscles to decrease. By reducing the tension in these muscles, if it's of tension-related origin, the tendency is for your headaches, your migraines, to decrease. But don't forget to always consult a doctor, seek out a physical therapist for a more individualized, specific treatment for your case. That's it for today then. I hope you enjoyed the video. Subscribe to the channel if you haven't subscribed yet, like the video if you haven't liked it yet, and share it with anyone you think needs to know this information. Thanks everyone. A hug, and see you in the next video.